Every year, over 20,000 people experience angina for the first time. Angina is a type of chest pain which comes from the heart when it's not getting enough blood supply. The heart pumps blood all around the body, but it also supplies a little bit to itself in what are called the coronary arteries. Anything that narrows these arteries, like a buildup of fatty cholesterol, can make the heart feel this pain. Angina has often been described as a pain or discomfort in the chest, but it also can be felt in the arm or the neck. And because the symptoms often go away with rest, it can be quite difficult to detect it using medical investigations. It sometimes comes down to simply a doctor's judgment on whether or not you actually had angina. There are medications that can be given to people who suffer from angina, but the best thing to do is actually to encourage lifestyle changes, such as eating healthier, exercising more, and quitting smoking and drinking alcohol. If you'd like to learn more about cardiology, drop a heart emoji below, and remember, every 40 seconds in the USA, someone has a heart attack. A myocardial infarction or heart attack is when a part of the heart muscle begins to die because of a lack of blood supply.
But I'm not a rapper.
The heart gets its own blood supply through what are called the coronary arteries. And if they're blocked by fat and blood clots, then the part of the heart muscle after the blockage won't get its supply and it begins to die. This can cause symptoms of chest pain, sweating, dizziness, and nausea. It can often be detected using an electrocardiogram, but also by a rise in certain blood markers, like troponin. Every minute is crucial in treating a heart attack. Treatment can even start in the ambulance, like oxygen, pain relief, and blood thinners. The hospital may even give a medication to break down the clot, or arrange for an emergency procedure to open up the arteries where the blockage is. Drop a heart emoji below if you'd like to learn more, and remember, almost 1 million people in the UK currently suffer from chronic heart failure. Chronic heart failure is when the heart isn't functioning as well as it should be, something that happens over a long period of time. With old age, high blood pressure, and conditions like coronary artery disease, the heart muscle gets weaker and therefore less efficient at pumping blood around the body. This can cause blood to back up, and the fluid inside the blood can begin to ooze out into places like the lungs and the feet, causing difficulty in breathing and puffy legs. Heart failure can be diagnosed with an ultrasound scan of the heart, known as an echocardiogram. And the treatment is often lifelong medication to reduce the blood pressure, stop the heart from working so hard, and the kidneys to urinate out extra fluid. If things get really bad, they may even prescribe a pacemaker or implantable defibrillator just to keep the heart going. Comment down below what we should break down next, and remember, over 2 million people in the UK suffer with arrhythmias of the heart. An arrhythmia is when your heart doesn't beat at the same rate or rhythm as it's supposed to. This is because there's a problem somewhere with the electrical conducting system of the heart, which can cause people to feel faint, dizzy, or even like their heart is beating funny within their chest. An arrhythmia can often be picked up on an ECG or EKG, as the Americans like to call it. Most times, some medication can keep things under control. However, on the other extreme, some people require a defibrillator under the skin, which sends an electrical shock to the heart anytime an abnormal rhythm is detected. If you'd like to learn more about cardiology, drop a heart emoji below, and remember, the next time you see someone faint, just remember that it's probably nothing. Unless it is. Fainting, or syncope, is when you pass out for a short period of time. For most people, it's probably nothing serious, but it doesn't mean that it can't be. There are so many different conditions that can cause someone to faint, like irregular heart rhythms, low blood sugar, low blood pressure, and anemia. But most importantly, you could be a completely healthy individual and still faint. Most people who faint often regain consciousness fairly quickly, so it's often not investigated unless there's a suspicion that something else is going on. However, if somebody faints fairly often, has a seizure, or has hurt themselves pretty badly by falling, then these are a few of the times where they probably need urgent medical attention. If you'd like to learn more about cardiology, drop a heart emoji below, and remember, have you ever wondered what medical students actually learn at med school? The Hippocampus TV breaks down medical education so that anyone can understand it, even if you're 10 years old. So whether you're thinking about medical school, want to impress at your medical interviews, or you're just a member of the public who wants to learn more, make sure to follow us. Watch us on TikTok, YouTube, or Instagram, or head to our website. We'll see you very soon.